We all have spots in our skin, moles, freckles, patches of discoloration. Most of the time, they're harmless, a simple result of sun exposure, aging, or genetics. But sometimes, what looks like just a mole is something much more dangerous. Sometimes, it's melanoma, the most serious form of skin cancer. Melanoma doesn't always start out looking scary. It can be small, flat, brown, or pink. Sometimes it shows up where the sun doesn't shine at all, but left undetected, it can spread fast to the lymph nodes, the lungs, the brain, and beyond. That's what makes melanoma so dangerous. It doesn't just grow, it moves. And yet, here's what makes it so preventable. Melanoma starts on the outside. It begins where we can see it. And like lung, colon, or prostate cancer, melanoma gives you a visual warning right on your skin, which means if you know what to look for, if you pay attention, and if you act early, you can stop it before it spreads. But too many people don't know the signs. They ignore the changing mole. They put off going to the dermatologist. They think, it's nothing. I've had this for years. And by the time they realize something's wrong, the cancer has already reached deeper layers where it becomes much harder to treat. Every year, tens of thousands of people are diagnosed with melanoma in the United States alone. And while survival rates are high when it's caught early, those odds drop fast once the cancer spreads beyond the skin. The good news? You don't have to be one of those people. In this video, we're going to show you what makes melanoma so dangerous. Early detection saves lives. What signs to look for on your own skin, how to check your body for changes, and what steps to take when something doesn't look right. This isn't about fear. This is about empowerment. Because melanoma isn't just deadly, it's also one of the most visible and treatable cancers when caught early. You don't need to be a dermatologist. You just need to pay attention to your skin, to your instincts, to your health. Let's talk about why recognizing melanoma early could make all the difference for you or someone you love. When it comes to melanoma, time is everything. And like some cancers that grow slowly, melanoma can progress rapidly from the upper layers of the skin into deeper tissue, the bloodstream, and distant organs. And once it spreads, it becomes far more dangerous and difficult to treat. But here's the hopeful part. When melanoma is caught early, it's highly treatable and often curable. In fact, when diagnosed in its earliest stage 0 or stage 1, melanoma can often be removed entirely with a simple outpatient procedure. No chemotherapy, no radiation, no major disruption to your life. That's the power of early detection. It doesn't just increase your chances of survival, it can completely change your outcome. But to catch melanoma early, you need to know what to look for and be willing to act when something seems off. Unfortunately, too many people don't. They assume a new spot is just aging. They ignore a changing mole because it's not painful. They put off a skin check because they're busy, or because they don't want to seem paranoid. And that delay can cost them everything. Here's what most people don't realize. Melanoma can grow in just a few weeks or months. It can occur anywhere on your body, not just sun-exposed areas. It can appear in people of all skin tones, though it may look different in darker skin. And it doesn't always look like a textbook scary mole. That's why being familiar with your own skin is so important. You don't need to know everything, just what's normal for you. The earlier you notice something new or changing, the more time you and your doctor have to deal with it on your terms. And today, skin exams are faster and easier than ever. Your primary care doctor can take a look. A dermatologist can do a full body check in under 15 minutes. And you can do monthly self-checks in front of your mirror, no tools required. Melanoma is one of the few cancers where you have a clear view of the battlefield. You can see it coming if you're willing to look. And when you act early, you don't just increase your chance of survival, you protect your health, your time, your freedom, and your peace of mind. In the next section, we'll show you what those early signs actually look like. Not medical jargon, just simple, visual clues that anyone can understand and remember. Let's talk about what melanoma looks like in the real world and how to recognize the warning signs that matter most. Melanoma is a skin cancer that gives us a unique advantage. It usually starts where we can see it, but that also means we have to know what to look for. Not every mole is dangerous. Not every freckle is a threat, but some are, and they have a way of showing it. If you know how to read the signs, let's break down the most common early signs of melanoma, so you can confidently check your own skin and know when to seek a specialist. 1. The ABCDE rule, the classic melanoma checklist. This simple system helps you evaluate moles and skin spots that may be suspicious. Here's how it works. Asymmetry: in half of the mole or spot does not match the other half. Healthy moles are usually symmetrical. B. Borderthé: edges are irregular, ragged, or blurred. A clean, smooth edge is more typical of a benign mole. C. Color: melanoma can have multiple colors or uneven coloring: brown, black, red, white, or even blue. A single, even color is usually safer. D. Diameter melanomas are usually larger than 6 millimeters, about the size of a pencil eraser, but they can start smaller. Pay attention to any mole that's growing in size. E. Evolving. This is often the most important sign. If a mole is changing in shape, color, size, or texture, or begins to itch, bleed, or crust, it's time to get it checked. 2. A new spot on the skin that looks different. Most of us have moles, freckles, blemishes, but melanoma often shows up as a brand new spot that doesn't look like anything else on your body. If something appears out of nowhere and feels unfamiliar, trust your instincts. 3. A spot that looks ugly duckling. This is a visual trick dermatologists use. Compare your moles to one another. If one mole looks completely different from the others, like the odd one out, it might be cause for concern. This could be a different color, shape, or size than all your other spots, and that uniqueness can be a red flag. 4. Itching, bleeding, or crusting. Even if a mole hasn't changed much in appearance, if it suddenly itches, frequent labels without reason, forms a scab or crust repeatedly, it could be melanoma. Normal moles shouldn't do that. Skin cancer irritates the surrounding tissue and often causes surface breakdown. 5. A sore that doesn't heal. A small skin wound that won't close up after a few weeks could be more than just irritation. Chronic sores, especially in sun-exposed areas, may be a form of skin cancer, including melanoma. 6. Spots on areas not exposed to the sun. Melanoma is more common in sun-exposed areas, your face, arms, back, legs, and neck, but it can also appear in the soles of your feet, under your nails, between your toes or fingers, in your scalp, even in your genital area. That's why full-body skin checks are important, not just a quick look at your arms. 7. Changes in existing moles. Even a mole you've had since childhood can turn cancerous. If it grows, shifts in color, raises up, or starts to feel different, don't ignore it just because it's always been there. Change is what matters most. Bonus tip: monthly skin self-checks. You can do a basic self-exam at home every month. Stand in front of a mirror with good lighting. Check your face, scalp, use a handheld mirror, or ask for help. Neck and ears. Look over your arms, chest, torso, legs, and feet, including soles and toenails. Use a handheld mirror to check your back, buttocks, and behind your knees. It only takes 10 minutes, but it could save your life. Remember, you don't need to find every spot. You just need to notice the one that's new, changing, or different. In the next part, we'll talk about what to do when you notice something suspicious, how to respond calmly, get answers, and move forward with clarity and control. So, you found something. A mole that's changing, a spot that's darker than the rest, an itch that won't go away, or a patch that suddenly started to bleed. And now, you're wondering, is this melanoma? It's a scary thought, but let's stop for a moment and talk honestly. Most skin spots are not cancer. In fact, many changes in the skin come from harmless causes like sun damage, age, allergies, or irritation. But here's what separates health-aware people from those who take risks with their lives. They don't ignore what looks or feels wrong. They get it checked. And that's exactly what you should do next. Step 1. Don't Google yourself into fantasies. You can do a quick search to learn, but don't diagnose yourself with internet photos. Everyone's skin is different, and what looks like a harmless mole online might be more serious in person. Instead of guessing, take action. Step 2. Take a picture of the spot as your phone, or ask someone to help. Take a clear, well-lit photo of the spot in question. Do this now and again in a week or two to track any changes. This photo can also be helpful to your doctor. Step 3. Schedule an appointment with a dermatologist. Don't wait for it to get worse. Don't tell yourself you're overreacting. Dermatologists are trained to identify skin cancers quickly and often with a single glance, using a tool called a dermatoscope. Most skin checks are quick, often under 15 minutes. Pain less, covered by insurance even if a biopsy is needed. The procedure is simple and done in office, often with a local anesthetic and no downtime. Step 4. What happens if it is melanoma? If caught early, stage 0 or stage 1 melanoma is usually removed entirely by surgery, with no further treatment needed. The survival rate is extremely high. If it's more advanced, your care team will guide you through next steps: imaging, testing, possibly immunotherapy or other targeted treatments. But the earlier you act, the better your options. Step 5. Don't let embarrassment delay you. You don't need to justify your concern. You don't need to wait until it's painful or bleeding. If something on your skin makes you uncomfortable, it's reason enough to check. And if it turns out to be nothing, great. That's peace of mind you wouldn't have had otherwise. Skin cancer isn't something to panic about. It's something to respect, to catch early, to deal with while it's still small, local, and manageable. In the next section, we'll give you a final message, one that reminds you just how powerful early awareness can be and why this moment matters more than you think. You know your skin better than anyone else. You see it every day. You notice when something changes even if no one else does. And that makes you powerful, because melanoma doesn't have to sneak up on you. It doesn't have to become a crisis. It doesn't have to take your time, your health, or your life. Not if you act early. Not if you trust your instincts. Not if you take responsibility for the one thing no one else can manage for you, your body. Too many people wait. They see the change, but they put it off. They tell themselves it's probably nothing. They let discomfort, fear, or pride keep them from getting answers. But here's the truth. Catching melanoma early could be the difference between a quick outpatient procedure and a life-changing diagnosis. It could be the difference between "I'm glad I checked" and "I wish I hadn't waited." You don't have to become an expert. You don't have to spend hours checking your skin. You don't have to live in fear. You just need to care. You just need to look. And when something changes, you need to act. Because this isn't just about cancer. It's about taking ownership. It's about knowing your body is worth protecting, and so is your future. You deserve to live with confidence. You deserve to live without fear. And you deserve to live long enough to enjoy every moment with the people you love. Melanoma is dangerous, but it's also visible, detectable, treatable. If you act early, you win. Let this be the moment you choose to pay attention. Let this be the moment you decide your life is worth a second look. In the final part of this video, we'll walk through the small but powerful steps you can take right now today to protect yourself and help others do the same. If this video helped you see your skin in a new light, if it made you pause, check a spot, or think about your health differently, don't stop here. Share this video with the people you love, your partner, your parents, your kids, your friends. Skin cancer can affect anyone, and awareness spreads faster than any disease. Challenge someone to do a skin self-check. Send them this video. Tell them, take 5 minutes. It could save your life. Leave a comment below. Have you had a skin scare before? Have you caught something early, or do you still have questions? Your story could give someone else the courage to take action. Subscribe to our channel for more life-saving content like this. We're here to help you stay ahead of the health curve with expert tips, early warning signs, and clear, easy-to-understand guidance. And if this video helped you, hit the like button so it can reach more people who need it. In our next episode, we'll cover thyroid cancer, a condition often missed until it's advanced, but one that gives early clues if you know what to listen for. So be sure to tap the notification bell so you don't miss it. And most of all, look again at that spot you've been ignoring, at the mole you've had for years, at your skin. Not with fear, but with respect, because early awareness leads to early action. And early action? That's how you save a life, including your own. Take care of your skin, take care of yourself, and as always, take care of those you love.